Hello, everyone, and welcome, and a very good morning, good afternoon, or good evening to you, depending on where you are connecting from today, from around the world. My name is Ann-Herod Lang. I'm the Executive Director of PHAP, the International Association of Professionals in Humanitarian Assistance and Protection. I am absolutely delighted to be welcoming all of you and serving as your co-host for this webinar today, Participation in Practice and the Grand Bargain, Examples of Inclusive Action for a Participation Revolution, organized by the Steering Committee for Humanitarian Response and PHAP. And now I'd like to introduce my co-host today, Gareth Price-Jones. He's Executive Secretary for the Steering Committee for Humanitarian Response and is connecting today from France. The SCHR is one of the co-conveners, together with the U.S., of Workstream 6 of the Grand Bargain, which focuses on bringing about this participation revolution and including people receiving aid in making the decisions which affect their lives. A big welcome to you, Gareth.
Thanks, Gareth, and welcome to everyone. Really delighted at the level of interest today. Yeah, this has always been an important topic. And it's even more so in this time of COVID, when the active participation of affected people is going to be really critical to how we respond in the coming weeks and months. So one of our goals as co-conveners of this workstream is to encourage the real embedding of participation into our humanitarian responses, and particularly in the organisational processes behind that. So if we don't have flexibility in the design, in the budgeting of responses, then we can't turn the active engagement of communities into change in the way that we deliver the assistance that they need. We are hearing from 4 practitioners today, but we're also very aware that there are many more on the webinar who are already making this happen in practice. So do please share your experiences in the chat box, and we're working with PHAP to capture those. This webinar is really important for us as well as co-conveners in that it gives us a bit of a sense of the progress at the field level. Yeah, it's all very well us having these things in place at the global level, but what really counts is the change at the field level. So do please participate in the polls, and what we'll do is we'll pull the findings out from that and share them back with workstream members. I'll leave it at that. Really keen to hear from the field practitioners. Thank you for those. Some of them are staying up very, very late to join us today, so thank you everyone. And thanks to everyone on the webinar who is making this happen in practice. It's your work that makes this a revolution rather than just a gradual change in how we plan, how we fund, and how we deliver humanitarian response. Thanks. Back over to you, Angarad.
Excellent. Thanks a lot, Gareth. And I'd just like to echo Gareth's point. There really has been a tremendous amount of interest in this session. Many of you already providing examples of your own experience of improving active participation, providing that through the pre-event survey. Please do continue to share your experiences through the chat, as Gareth mentioned, so that we can compile all of that and feed it into the work stream. Regarding the polls, I'd just like to briefly mention that we will actually be processing the results of the pre-event poll questions. We're going to be processing those live now in real time so that we can share the preliminary results with you towards the end of today's session. And in particular, our team behind the scenes here is going to consolidate your responses regarding the preventing factors and enabling factors. And then at the end of the session today, we'll ask you to vote as to which factors are the most important in your context, and that will really help to prioritize the inputs that are coming out of today's event. So thank you very much for your participation so far, and also anticipating your participation in this exercise that we'll have at the end of the session. So now, without further ado, I would like to introduce our guest panelists. Today we will be joined by 5 speakers. 4 will be presenting examples of what they have been doing in their work to strengthen participation. First of all, I'm very happy to welcome May Jarrah. She's connecting from East Jerusalem, Director of the Women's Development Program with the East Jerusalem YMCA. Welcome, May. Very glad you could join us today. Okay, I think May's connection is still in progress. But a big welcome to you, May, and we'll be hearing from you very soon in any case. We'd also like to welcome Seda Kuzuju, who is connecting today from Kenya, Senior Protection Coordinator for Kakuma with UNHCR. And welcome to you, Seda. Do we have you on the line?
Yes, I'm on the line, and welcome to everybody. And I'm very happy to be connected and to present what we are doing in Kakuma. Thank you.
Terrific. Thanks so much for being with us, Seda. And next, delighted to welcome Nanette Antekesa, connecting from the Philippines. She's holding several relevant positions, including sectoral representative to the National Anti-Poverty Commission Victims of Disaster and Calamities, as well as co-convener of the Community-Led Emergency Action Response Network. Terrific to have you on the line, Nanette.
Hi. Thank you. Good evening. Thank you for inviting us here, and good evening to all from the Philippines, and welcome.
Wonderful. Thanks so much for being with us. I know it's getting late there now. And then we have with us as well, I'd like to mention, welcome Charlotte Lancaster, connecting from Italy, Global Accountability to Affected Populations Advisor with the World Food Program. Big welcome to you, Charlotte.
Thank you very much. Happy to be here and looking forward to the discussion. Thank you.
Terrific, thanks. And then we're also happy to have with us Meg Sattler. She's connecting from Australia. She's Senior Program Manager with Ground Truth Solutions, and she's going to be coming in towards the end of the session to be providing her perspectives from having worked worldwide on ways to help people affected by crisis influence the design and implementation of humanitarian aid. So glad you could join us today, Meg.
Thank you so much, and good to see this is definitely not a manel, so that's great.
Yes, very true. And terrific. So welcome to you all. I'd just like to quickly check the connection of May. May, are you on the line?
I can hear you. Can you hear me?
Yes, we hear you loud and clear. That's terrific. Thanks so much, May. So in fact, I would like to turn to you first, May. You have been using different approaches for community participation in your programs at the East Jerusalem YMCA. Could you tell us what you're currently doing in this area? Over to you, May.
Thank you. Actually, we have started new approaches, and now we have been working through those approaches for almost 9 years. Our approach is called Participatory Vulnerability Capacity Assessment. From the name, we work on people's capacities, not only vulnerabilities. So the idea is that we work with people. So we try to build on what the capacities that they have. I want just to give a little brief of what we do. Is that in any community we work with, we approach everyone in the community, all societal groups. This means men, women, youngsters, elderly, people, working people, employed, unemployed, women staying at home. So we include everyone in the community. And with all those people, we give the training in how to analyze their capacities and their vulnerabilities. And based on those capacities and vulnerabilities, we ask each group of them to do their own action plan to respond to those vulnerabilities they have based on the capacities. And if they do not have enough capacities, we ask them to if they need experts, they need more training, etc., to help them tackle those vulnerabilities and risks they face. After we go, we have a work plan from each group. We gather all the action plans from all societal groups, and we have one action plan, and the community will vote on their priorities. After that, we give the community the other approach that we started to use almost now 5 years ago, with the help of our partners, is that we start to give the community cash grants instead of us stepping in and start to implement on behalf of the community. We started to give the money to the community, because in each community we have what we call protection group. The protection group is representing all the societal group, and they take the responsibility to lead the implementation and response to the action plan. This protection group is open. Anyone can from the community can enter in any phase. So we give them the money, so they start to respond. The money that we give them, they figure out. We have some experts who came in the communities, and they develop together with the community the way they want to implement those cash grants. So in each community, we give a maximum of $5,000 for the people who start with establishing implementation committee, the one who will receive the check and they will start to implement, and another committee which is accountability committee, whose responsibility is to look for those people who are implementing to make sure that everything is implemented. So our role becomes a mobilizer, a community mobilizer, and not an implementer.
Okay. So we will be coming back later to May. Unfortunately, for the moment, we have lost the connection with her. So we're going to, if I may, turn to you next, Seda. I hope that you're still with us on the line. I believe that you have an example that you can share. Great. I believe that you have an example you can share with us from working with UNHCR in the Kakuma refugee camp. Could you explain to us what was the situation that you were trying to address in that context, and how did you identify it? Over to you.
Thank you very much, and good evening or good afternoon or good morning to everybody. Kakuma refugee camp and Kalabaya settlement are hosting 194,000 refugees from 20 nationalities, and 50% of them the youth. So during our traditional participatory assessment with refugees, we highlighted that communication and no feedback and lack of trust, especially to the protection, are the key issues. So we need to find a new way to complement the existing counseling and complaint mechanisms. We want to improve the two-way communication with refugees, especially by giving timely feedback and extend the use of innovative tools that allow refugees to monitor services delivered, and also to have a predictable timeline for the service delivery. We understand that we need to strengthen the dialogue to support more transparent feedback system. How can we do this? By working with the refugee communities and individuals as they are the agents of protection and change, and keeping in mind that the 50% of the refugee population is youth. And we want to put the refugees as the key player in the design and implementation and monitoring our intervention. Hello, over to you.
Oh, yes, thank you. Sorry, I was afraid we lost you there. Yes, excellent, Seda. Thank you for that. Could you tell us a bit more then about the solution that you put in place?
Sure. We locally developed an online self-service system called KASI, Kiosk Automated Services and Information. In Swahili, it means speed, which uses open source platforms and is protected by two-way authentication and biometrics. With the introduction of these tools, refugees first time allowed to have access to key information of their UNHCR files, like photos, biodatas, updates on the resettlement, refugee status determination, and documentation like ready to collect your documents. And secondly, it provides flexibility to refugees to seek appointments for various UNHCR services. The appointment schedule is opening 3 weeks, morning and afternoon, in 4 locations in the camp. And in every location, we have 2 or 3 kiosks, mainly the laptops. And thirdly, we remove the barriers in accessing information and services. They don't need a third person or an entity like a refugee leader or a partner, even a UNHCR staff, to access this information. It's an individualized feedback system and it's transparent. Fourthly, it's especially for the managers, is managing the resources and the workforce to identify areas of intervention and solution. When we do the data analysis, we have more evidence base. Like in the first year when we roll out, we find that the refugee complaints are mainly high-value activities, like they want to know their results on resettlement or refugee status determination. But when we look at the second year, refugees, they understood that they can get this information directly from CASI. They started to bring their daily problems like shelter, quality of the medical services, latrines, wash, and energy, including nutrition, to us. And we began to refocus our programs on feedback mechanism on these areas, like not only building a shelter, but like a customer service, how we can do the repairs, and within a time limit we should do this. And with this we started to have more targeted response mechanism, and it is more becoming a cost-effective. Over to you.
Perfect, thank you. I have another follow-up question for you, but first, just a quick note to our captioner. If you could please reconnect the captioning pod now. Thank you so much. Okay, so Seda, you mentioned that this solution was locally developed. Could you tell us a bit more about how it was developed? Back to you.
Thank you. Actually, it is developed by two UNHCR staff. The full credit is given to the head of office, and I also assisted him on the protection part. Both of us have legal background, but we have an interest on the data and the IT. And then we work with one external consultant, developer based in Netherlands, who traveled to Kakuma every 2 months to stay 15 days during his 11-month contract. After meetings with all parties, including refugees, and we did the desk review, as you might know that Kakuma is very famous among the master and the PhD students. So we look at all the researchers and we identify certain Kakuma context issues, like 98% of the adult refugees in Kakuma have a simple mobile phone and they are actively using it. So we thought that we need to establish a mobile phone-based solution. Women have equal access to mobile phones like women, 50%. And there's a good 3G internet coverage connectivity, so we can do a web-based solution. 60% of the adult refugees have smart or the feature phones with an access to internet. 70% of the refugees have no email addresses, so we need to focus on the SMS system. And with this, within 4 months period, we developed the first version of the tool, and we used an agile system. And we want to make sure that it's designed in a way that people do not need computer skills, like intuitive. And we are now in the version 5. After 6 months from the first rollout, with the feedback from the refugees, we have the latest version, version 5. And it is working fully now, and it is in 10 languages, and it is also for the person with disabilities. We have also a system that the UNHCR staff can assist it, but we find that already the population, they find their solution bringing their younger children or the youth to assist them, like the blind persons especially. And now the government of Kenya is also using this tool to have appointments to issue documents. And the SMS system is really like a feedback system. Whenever you have an appointment, whenever you have a modification or a cancellation, you receive an SMS. And this is not replacing the existing traditional counseling or the complaint mechanism, but we are telling to people, if you have an access to mobile phones, please use CASI. Over to you.
Great, thank you, Seda. That's very interesting and I think very helpful as an example also for people working in other contexts. I wonder, just as a last question for you at this point, what would be the main takeaway from your experience that you would want to highlight, especially for other colleagues working in other contexts? Back to you.
Thank you. I think there's one thing that we struggle a lot is change is not easy. Behavioral change, the process was not easy. When we first introduced to our own staff, we got so much negative feedback. But even from the partners, we got negative feedback. The only positive feedback we got was from the refugees, because they really understand that they will get the information, it will be a transparent, and it's happening the first time. So I think, and it's the cost effective also for us. The only cost that we pay for this tool is the cost for the consultant for 11 months. So, and it's more participatory. For the last 2 years, almost 72% of the camp, they are already enrolled to CASI, and they are coming frequently to the field post to raise their concern. The second issue that I want to raise maybe is the impact analysis versus deliveries, because in often in UN we are always looking at what is our deliverables, meaning how many schools we build, how many people that we train. With CASI we understand that you need over more than 12 months in order to have the change impact. Because in the second year, by using the CASI, people started to, including the partners, understand the use of CASI. Now, through CASI, refugees are really monitoring the services of UNHCR and the services of the partners, because we give the partners and even UNHCR 15 days for any complaints to be sorted out and to give a feedback back to the refugee. And third, and the most, is actually one cannot feed for all. This system worked in Kakuma after we did the analysis of the context. So everybody has to look at their own context and then decide if it's applicable in their context or not. So this is because we receive so many questions, can we have this system in other operations? And UNHCR headquarters is already thinking to have this tool as a corporate tool. But we are always saying, please look at your own context and then find out. One of the other things what we noticed, the refugees, they started to bring more issues about the registration to be a self-help group or the community-based organization. Through this, we started to have more awareness for that, and then we have more CBOs or self-help groups is now also including in the programming part. Over to you.
Great. Thanks very much, Seda. Really important takeaways, and very happy to be able to take note of that for the ongoing work here. So I'd like to turn next to Nanette. In your work on crisis response in the Philippines, you've been working for several years to improve the approach to participatory response. But starting out, how would you describe the situation in the Philippines before you got started? What was the baseline? Over to you, Nanette.
Yeah, thank you. Yeah, before we started the approach, I would say generally the humanitarian system was led by international agencies with local actors mainly serving as subcontractors, except for those with partners already supporting participatory processes at the time. Decision-making in humanitarian response was generally top-down, I would say, with little room for the crisis-affected to influence in terms of programming and prioritization. Planning had been heavily cluster-based. Agencies plan and budget, generally done according to the priorities of the agencies rather than based on the priority needs of the crisis-affected, which somehow still holds true, not till at present in some degree. Crisis-affected mainly served as recipients of anything that would be provided to them by the humanitarian agencies, based on latter's rapid assessment. Duplication of relief assistance to families, we have even observed that was a common occurrence while depriving others. While humanitarian responses were still of big help, I would say, to the affected of disasters in our country and continue to be one, but participatory response approach was generally lacking in the process. Crisis affected were mainly considered more of like victims, than survivors with capacity.
Okay, and
to also help themselves.
Yes,
over to you.
Yes, thank you for that,
All
Nanette.
right.
And so could you tell us about then the approach that you followed? So given that baseline, then how did you begin to move forward? So what was the approach? Back to you.
Thanks. The approach, yeah, we ensured that the people receiving aid participate in making decisions affecting their lives is what we aim, no, in the approach that we are promoting called Survivors and Community-Led Response Approach. For 3 years now, EcoWeb, organization with our partners, was able to apply the SLR approach in various disaster contexts for the last 3 years in the Philippines, in flash floods, earthquake, typhoons, displacement due to armed conflict, in both easy and hard to access communities. And now we apply the same principles in our initial response, no, to COVID. The SCLR approach, we could explain this, no, it maximizes the role of crisis-affected communities to lead and implement their own response through their self-help groups, existing or newly organized, based on their own participatory assessment, prioritization, planning, and budgeting. The approach makes use of their existing capacities and enhance it rather necessary, but ever necessary. Each self-help group designates their leaders. At least we ensure that one is a woman, if not all, who serves as the representative in their succeeding actions in engaging with our team. SLR approach makes local NGOs like EcoWeb as facilitators of the action rather than implementer. It informs the community also the complementary or gap-filling role of international agencies. The approach promotes the recognition and importance of working with local structures, community leaders, and local volunteers. It advocates and supports for a genuine holistic crisis responses that allow all sectors, including relief, WASH, rights protection, peace building, and advocacy, among others, that demonstrate humanitarian development nexus that hopes to address root causes of vulnerabilities. ECLR also recognizes that affected community is not homogeneous and that response to be more effective has to be socially inclusive of more vulnerable persons and families. The SLR approach enables affected community to consider vulnerabilities as well as capacities of families in their planning and programming and allocation of budget. Vulnerabilities identified include identifying families with elderly, persons with disability, small children, orphans, pregnant and lactating women, female and single-headed, having health condition, culturally marginalized, the size of family, among others. It promotes the use of cash programming that enables flexibility, enabling the aid recipients individually or as a collective to address real-time needs with dignity. It responds to psychosocial needs, observes cultural sensitivity, and recognizes that strengthening community cohesion is critical to local resilience. SLR practices transparency as well by way of multi-directional accountability system. Downward to the aid recipients, sideward accountability by self-help groups and community leaders to the members of their group and communities, and upward to the donors. This is tackled in the orientation and training in the implementation of the project. It enables affected communities through their designated representatives with support from the local and humanitarian actors and networks to advocate and influence government as well, to uphold social inclusion and protection of rights of the affected in their programming and policies. It encourages networking, complementation, and principled partnerships. In SCLR, facilitates coordination with humanitarian actors as much as possible, representation in coordinating bodies, pooling of resources, and sharing of information. It advocates for changing institutional roles, relationships, and systems. Well, we aim to until the aid recipients become the center of the humanitarian response and not the aid itself. Back to you, Anggar.
Terrific, thank you. So you said that you've now followed this approach for 3 years throughout the Philippines. Was it equally successful everywhere, did you find? Or were there factors that made it more successful or less successful in certain situations? Back to you.
Yeah, it's not that everywhere it's the same level of success. There are actually varying factors that also affects the success of all the initiatives. And yeah, in various crisis settings where we have implemented involving people of different ethnicity, culture, and faiths, we learned that there is like common factor that made it successful. So the availability of funding that is more flexible, timeliness, and I would say it happened and it was made possible because like there was this trust between us and our funding partner, because without it, it might be very much like hard for us, no, to implement this approach. So the same, no, like because we said trust is a factor, not only between us and our partner, but trust us as a facilitator with our community partners. So the trust that they can help themselves and that they have capacity to plan, design, manage, and implement. So this is an important factor that we see as a very important. The same factor, not trust, that we as local actors consider as important factor for localization that we are advocating to work. An inclusive action will only materialize, as we are saying, and we are advocating, if we strongly believe that it is the right thing to do and acknowledge that we need to change to make change happen. It cannot be done by expressing commitment in words only without bold action. And trusting that survivors is one of such bold action that we are actually seeing as an important factors. But as I said, no trust, somehow it's intangible, but making the flexibility of funding provided by our partner is like the specific action of trust that we are seeing as important factor, and of course timeliness of this funding as well. Back to you.
Perfect.
Okay.
Thank you very much, Nanette, and I hope that we'll be able to come back to you later in the session. I see that we have a number of questions coming in, and I know that there is more to discuss, but in the interest of time now, I'm going to move on and really pick up on that theme of trust that you raised. So you really highlighted the importance of trust, and I'd like to like all of us, to keep this in mind as we turn to our next panelist, Charlotte. One of the projects you have been working on with WFP has been a partnership with UNFPA and with UNFPA implementing partners in coordination with the Ministry of Health in Nigeria on enhancing food and nutrition security outcomes through integration of sexual and reproductive health and rights and gender-based violence protection. This is an area where I would expect also trust to play an important role. Could you tell us, please, about your approach in this project? Over to you, Charlotte.
Hi, yes, thanks very much. So yes, trust is a very important component of participation. And in fact, I believe you can't really have one without the other. And this project that my colleagues in Maiduguri, Nigeria implemented, I think really speaks to that. For when you go into a conservative community to discuss issues around the links between nutrition and reproduction and maternal rights and GBV, you're accessing a very sensitive and commonly hidden part of any community. And to be granted access to that part of the community, WFP worked closely with UNFPA and its implementing partners, as well as the Ministry of Health, to identify a group of female and male community volunteers to train them in sexual, reproductive, and maternal health, as well as to train them in how to refer GBV cases in a safe and secure manner. We worked with those same community volunteers to understand traditional beliefs around, for example, nutrition and pregnancy. And we learnt through the session that there's a belief that women should not leave their house for a number of days following a delivery, which kind of course, prevents a woman's access to healthcare and nutritional supplements at exactly the time when she may need it the most. We also learnt through this consultative process that 50% of women in the area do not have a form of employment outside the house. And this combined with low literacy rates in the area means that women generally do not enjoy movement in the public sphere, further restricting their access to healthcare and services. The women who do access healthcare services, only 2% do so for nutrition reasons. We also learned through these consultations that the community responded well to storyboards and pictorial messaging. And so WFP and UNFPA expanded our communications approach to fully embrace this communication medium. And we also learned that we had to expand our linguistic reach by translating communication products into Kanuri and Shua Arabic, moving beyond English and Hausa, the predominant languages in which the original communications products had been produced in. And we also had to increase the linguistic diversity of our volunteers to ensure that we were able to communicate with a wide section of the population, including minority speakers, who are commonly the most at risk in a community. And what was super interesting about engaging with male community volunteers is it allowed us to facilitate a discussion with men about the role of men in nutrition and the home. And the contribution of the male volunteers was crucial in establishing a safe space for men to talk candidly about the role they can play in choosing food that meets the nutrition requirements of pregnant women and adolescent girls, and to talk candidly about how as men, they can better respect their partners. And these discussions were really framed in a way to reinforce positive masculinities and the positive role that men can play regarding food and the home. And to ensure the longevity of the project, we also replicated this engagement with the Ministry of Health, working with them to identify health centers in host communities where we could attach women and girl-friendly spaces and basically offer women a safe area where they could access maternal and nutrition services, could be referred to specialized support services, and they could find a support network among peers. And all of these steps contributed to strengthening the local ownership of the project, the sustainability of the project, and the transformation of attitudes around nutrition, sexual reproduction, and maternal health, as well as helping to combat and prevent GBV. Now, while it's hard to measure the impact of a 12-month project, by building a relationship with the community, we documented improvement in the number of referrals to GBV services and improvements in the number of referrals from the women and girl-friendly spaces to WFP and partner nutrition programs. We also received anecdotal evidence that community volunteers, especially the women community volunteers, felt empowered with their role and the associated access to knowledge and information, which allowed them to play a different role in their community and allowed them to participate in the public sphere in a way that they hadn't been able to previously. And crucially, we learned from the process too. The project launched an improved integration of protection-related messaging within all of WFP's social behavior change communication, including messaging on gender-based violence and sexual, reproductive, and maternal health. And it also improved coordination and collaboration between nutrition programs and GBV services in areas where WFP and respective GBV actors are working to promote safe and confidential referrals. So going back to your initial point, yeah, I totally agree that trust leads to access and that leads to participation. And these are three areas which, in my view, are mutually reinforcing. Thank you.
Terrific. Thank you very much, Charlotte. Was there any opposition that you found to the approach that you used, any opposition by any actor, or were there any other challenges that you encountered?
I wouldn't say that we experienced opposition as such, and perhaps this was in part because of the way that we engaged with the communities and the authorities. But I would say that a challenge we faced was the short implementation time frame for a project that was new to us and we really didn't have much experience in before. In order to explore the linkages between nutrition and gender-based violence, it requires that you can gain a level of access and trust level of access to and trust with communities, to encourage them to speak up and challenge beliefs, to challenge the way that they would approach a situation, to open themselves up to a different way of thinking. And of course, this takes time to achieve. So I think we achieved a great amount in 12 months and sowed the seeds for improved services in the future. But I think, yeah, that the short time frame for implementation was a challenge.
Great, thanks. And one more question then before we move on. What would be your key takeaway for people working in other contexts? What could they learn from your experience? Back to you.
Yeah, that's a great question. Thank you. I wouldn't say, I'm probably not going to say anything too original here, but really just get the basics right. Really understand the community that you're serving, understand the sub-communities, the different segments of the communities, to really understand what the needs are, their beliefs, their fears, their stigmas, to understand how you can work best with them. And fundamentally get the language right. We see time and time again that we're using the wrong language to communicate with people. It means that we're actively blocking ourselves from being able to access certain communities. And if we can't communicate in the right language, then really we're not communicating. So I'd say really the fundamental message for me is just get the basics right, which commonly we don't do. Thank you.
Excellent. A very good point, Charlotte. Thank you so much for sharing with us and for distilling that message at the end, getting the basics right. I think very valuable indeed. I'd like to turn to Meg. So again, Meg Sattler, Senior Program Manager with Ground Truth Solutions. We've now heard, going through our panel of practitioners, about the approaches followed in 4 different contexts to ensure a participatory response. You've been working with Ground Truth Solutions on ways to help people affected by crisis influence the design and implementation of humanitarian aid. Could I ask, what are your own reflections on these examples that we've heard today, and what do you think that we can all take away and learn from them? Over to you, Meg.
Thank you so much. I hope you can all hear me. Tell me if you can't. And first of all, thank you so much to May, Seda, Nanette and Charlie. There's certainly a lot of talk in the participation space, which isn't always the most practical. And so hearing very clear and real examples is such a breath of fresh air. I'm going to echo Charlie's urging to get the basics right. And I think these were some great examples of that. I'm currently working with Ground Truth Solutions, leading on both our humanitarian reform work and now also the response to the COVID crisis. And listening to these presentations in the midst of this unprecedented crisis has given me quite a lot to think about as regards both. So I've probably got about 5 main reflections from what we've just heard. And the first one would probably be just a recognition of how far we've come. There are many people on this webinar, for example, Charlie, Gareth and I, who have been in many of the same meetings and calls and workshops over many years, where we've been pushing for participation in humanitarian aid to even be taken seriously at all. And it seems we've been able to move from this idea that we should be more consultative to pushing more informal structures to then having policy changes and seeing some actual progress. Not just in the fact that participation is happening, but how, and to really look at this inclusion element that came out from all of the examples, the need to tailor approaches to different groups, and the recognition that this isn't an end in itself, but rather needs to be linked to decision making. I think often we measure Grand Bargain success, and I'm guilty of this too now that I work globally, but we measure success in terms of frameworks and matrices. And I much prefer the approach of just looking at good examples from countries where we work. I think it's obviously easy to take the microphone and promote community engagement and quote Jeremy Conondike and all the things that we're all guilty of doing, but the real work is in showing how it can be done. So I think first off the bat, that's a real positive. The second reflection from me is that all of these examples, and I was taking some notes when I was listening to them, at least begin to touch on fundamental principles of dignity and power. And these examples of participation not as a programmatic area that's siloed, but rather as a means to shake up the systems that we know are not conducive to actual community empowerment. I liked what Nanette said, particularly about changing institutional roles, relationships and systems until aid recipients become the centre of the response. But at ground truth, our surveys along various lines of questioning find that the very human elements of whether people feel that they're heard in humanitarian situations and whether they feel positive about their prospects for the future actually remain very low in almost every humanitarian situation in which we work. And so I think we do have to pause and I guess admit that we are kidding ourselves a bit if we think that the answer to this is limiting ourselves to a few programmatic tweaks or, you know, adding questions to needs assessments or setting up a hotline or those sorts of things. What I loved about these examples is that many agencies still think participation is having a mechanism for feedback. And even at that most basic level, the vast majority of people that we survey say they don't in fact even know how to ask a question or provide a complaint, let alone to participate. And so I think it's good to focus on examples like the ones we have today, and then also take them a step further to think about where their systemic links are. You know, are they linked to decision making? Are they linked to funding? Are they linked to who does what in a response? And these more systemic issues are what we need to be linking every project idea on accountability or participation to. And I'm actually hoping that this current crisis spurs that along a bit. I also wanted to pick up on a point that I really liked from Seda in terms of this idea that we would shift aid workers from being implementers to being community mobilizers. And obviously in Palestine there are quite a number of examples of this. It definitely isn't the norm worldwide. So let's just be positive and imagine for a moment that this could be our role in every response. And then the conversation quite dramatically shifts from what we know of traditional aid systems. The questions become less, what do people need? What do we need to provide? But more, is there sufficient access to resources within this community for what they want and need to do within their own systems and structures? And if not, where do we as an international system either fill those gaps or try to help foster those systems and structures themselves? And this is where localization and participation start to go hand in hand. I think cash programming presents an amazing opportunity for this, but we definitely need to continue looking to our great field colleagues for examples that we may be able to scale. In some ways, this might not be comfortable for a lot of aid agencies because I think at some point it does start to trump the kind of sustainable development role or methodology in some ways and does make the humanitarian contribution a bit less or at least a bit different. Another thing that I'm just thinking about is how we can take some of these good examples and make them much more systemic, and I can't highlight enough the role that donors can play in that. And what's particularly great about the Participation Revolution workstream is how much donor engagement there has been and will continue to be. I think there's a number of things that we can be doing now in terms of what donors could be asking for. So demanding kind of reports on participatory processes that focus on outcomes and not just activities or outputs. You know, how were programs led by communities? How were they changed based on community feedback rather than just what structures were in place? I think it's also good to look at how these participation methodologies start to trickle across an entire response, and I think donors also have a great level of influence in that regard. And I know I don't have all day, even though I could talk all day, but the last thing that I just want to mention is the big elephant in the room, in the E-room, and the elephant's wearing a face mask and he's aggressively washing his hands. And I think that the COVID response has really thrown a lot of challenges to us as humanitarians, and examples of humanitarian good practice in participation are perhaps all challenged by the COVID response, especially if the response is not being fully conducted within communities and by local actors. I think it's shown us that a lot of our claims about localization and the level to which communities are involved, it's become quite clear that because agencies are now panicking about both how to deliver aid to and communicate with affected populations, we've probably not done as well as we could have in the past. And as countries respond to this and travel bans take hold and authorities start to retreat to nationalism, perhaps this is going to be an extreme way to spur on the localization agenda. And so it's a great opportunity to learn from some of the incredibly innovative work that's been happening in besieged areas, in participatory programs for years. and how humanitarian actors have or haven't been able to support these community-led efforts from a bit of a distance. And I think that all the grand bargain objectives would sort of hope that we were heading in that way, and so hopefully we'll get there soon. And just a final note, because trust came up, we have done some analysis on trust a couple of months ago for the Red Cross, and in trawling through all of our data found that about 70% of everyone we've ever surveyed said that they trust aid actors to act in their best interests, which is actually an incredible amount of goodwill, and much higher than if you look at across the board statistics about people trusting their authorities, for example, or some of their other systems. And so I think it is a great opportunity for us to make sure that we're being good stewards, I guess, of that trust and doing the most that we can towards this participation agenda. So I'll stop there, but thanks for giving me the chance to reflect.
Wonderful. Thank you so much, Meg. It's been really helpful to have your reflections, and we may have time at the end to come back to you during some Q&A. If we don't, and this goes out to all of our panelists today, I hope that you might be willing to work with us to look at some of the questions that have come in and perhaps even provide brief responses in writing so that we can continue the conversation after our short hour and a half today. So thanks again, Meg. I'd like to once again try and come back to May. I think we've got you on the line now. Could I test that, May? Are you there?
Hello?
Oh, great. Great. I think we have you back now. May, so thankfully, we were able to, I think, hear you for all of your presentation of the approaches that you're using currently for community participation in your programs with the East Jerusalem YMCA. I wonder if I could just skip ahead to that essential kind of last follow-up question and ask you what would be the main takeaway from your experience with East Jerusalem YMCA that you would want to highlight, especially for others in other contexts when it comes to participation. Over to you, May.
Yeah, thank you. Actually, I would like to say that we should look at participation as our approach. It's not just we use participation like rapid assessment or etc. It's about how we do our work, because at the end of the day, we all are doing the same thing, the same output. But the most important thing is how we do it. This is where we should concentrate. This is the most important part. So it's an approach. It's not just a tool. This is one thing. One other thing I would like to tell our international NGOs partners that we need to prepare and offer a solid alternative to our donors. It's not about, because usually we say we want to change our approaches, but they don't know how. We don't ask, we don't give alternatives, we do not give a solid thing they should think about. If they want to change their approaches, we should tell them how. This is our job and our international partners' job. The other thing, it was a lot of talk. I heard a lot of talk about trust, and it was one of my points to talk about trust. It is about trusting from the international NGOs to the local NGOs. We need to trust each other. We should have a room to fail, because without failing, we need to try. Without trying, we don't know how to improve. And one other important thing I say to local partners, that if you are trusted from your international partners, please trust the communities, because at the end of the day, we are working for those people. Make sure not to hold the power. We are asking our international partners not to hold the power. It is our duty also not to hold the power. We should trust that people can do more with their own resources. They can have leverage, they can access their own communities, they can access the private sector if they know how and if we trust them. At the end, I want to make sure that we should always remember it is not about what we do, it's about how we do it. Thank you.
Thank you very much, May, and I'm so glad that we were able to reconnect with you. Those were some very powerful takeaway points, and I'm so glad that we had the opportunity to hear those from you. I would now like to move on to the exercise that I mentioned at the beginning of our session. We'd like everyone on the line to participate. So as you'll recall, we asked you in the registration for today's event what you thought about whether active participation was feasible or not in your context. And we have combined those results. We've put together the preliminary results, and we see that about a third of you thought that active participation was very feasible. Almost two-thirds found it somewhat feasible. Only 7% did not think it was feasible at all. We also asked, is participation actually currently happening? And it was encouraging to see that there was still only a small percentage, now 10%, found it was not happening at all. However, we did see a smaller percent of people very optimistic that it is both feasible and currently clearly happening. We see a lot more people in that somewhat happening area. So there's clearly room for improvement according to these results. And I hope that some of the examples presented today will have provided some ideas for how this can be improved, practically speaking. So you were also asked about what you found to be the most important enablers and blockages in your context. And we've received some very rich results here. We've been processing them live during the last hour. And we're going to be providing the full data to Gareth so that it can feed into Workstream 6 continued work. But in order to get a more global view and also to help prioritize the issues that you are all facing, we have done a preliminary quick categorization over the last hour of these responses. And we'd like to now ask all of you to participate in a short exercise to help prioritize these. So you'll see now on your screen two polls with enabling factors on the left and preventing factors on the right. Please, if you could select a maximum of 3 in each one. So a maximum of 3 enabling factors on the left and select a maximum of 3 preventing factors on the right that you think are the most important in your own context. And do note that you may have to scroll down in each poll to see all of the options. I think there were 15 or 20 or so options in each list. So there's a bit to read there, so I'm going to give you some time to answer these polls, and while we're waiting, I'll just maybe read out a few of the responses, the specific responses that came in. Again, it's really a lot of rich content here. Also on your side, once you've finished reading through the factors on the left and the right and making your selections, please do feel free to leave additional comments in the chat on the left. I see a lot of people there in the chat are, they have been sharing throughout the last hour some of the experiences, the lessons that they have from their work. Please do continue to share in the chat and comment as you'd like once you've finished with the exercise. So just in the background here, as we give you some time, I'll read a few examples that came in. So examples of preventing factors or blockages. We heard from Carolina in Sweden, a lack of predictability in donor structure, where opportunities come with short deadlines for proposals, hindering meaningful participation at early stages in the planning. We heard from Ndunglis in Cameroon that access into some communities still stands as a great challenge, and this makes it hard to reach the targeted persons. An important point from Mohammed connecting from Somalia. He wrote that people are not understanding their rights, and that in itself is a major preventing factor. We heard from Andrew, connecting from Kenya, about fear of changing organizational program models based on feedback from communities. That links back to some of what we heard from Seda about the challenges of change management and how that can be a major barrier. An important point from Sarah, connecting from South Africa, of course, a lack of resources beyond the initial response. So a challenge of sustainability there when resources dry up after the initial response. And from Dismas in Ethiopia, the challenge of understanding participation on the part of the humanitarian actors themselves. Most humanitarian actors limit participation to information and don't go beyond that. And in addition, participation is limited to representatives only. So looks like we're doing pretty well here with the response numbers. Okay, great. So it looks like almost everyone has responded. If you haven't, I see a few more responses coming in. Okay. Okay, very good. So I think we've got a critical mass there on the responses. So I'm going to move on. Gareth, could I turn to you for your reflections on the results that we've seen coming in?
The first point for me was that importance of sustained engagement. You know, as we were discussing in the chat box, it does take time to build the trust with affected people. We know that it's often negative to start with. We know that, so we need to ensure that longer-term engagement, and that's often difficult when you've got limited funding, limited duration kind of programs and projects. Really heard the point from Charlotte on effective media and language. I think we know that, but it's something that takes time and takes resources. So we really need continued effort on that, and I know it's difficult and I know it's tricky. One of the other points that was quite new for me was this point about the fact that we maybe need cross-response approaches. So it's no good if one agency or one NGO builds trust with a community for another agency that's working with that community to then not respond and not engage. And that trust, once it's earned, is so easily lost. So as I think some of our other speakers said, you have to get the basics right, but I think we need to be consistent on that across our whole community. And then the last point I wanted to highlight was this piece about donor engagement. We really do have that within the workstream, and this is where the grand bargain is great because it does include donors as well, and it does provide space for them to discuss. So we've already had one donor conversation about this. We're planning more. So I think that's where we really get the donor support that makes this possible. I think that was all the points I wanted to highlight, but really interested to hear from others. Over.
Great. So could I check if we have Meg on the line? We were hoping to get some reflections from you as well. And I apologize, Meg, we're not able to bring back up the live results of that polling exercise that we had just completed. But perhaps, if we're lucky, perhaps you had taken note of that before everything crashed with the server. Do we have you on the line, Meg?
Yes, can you still hear me?
Yes, loud and clear.
I guess it's less of a reflection and maybe more of a question for further thought from all of us, but given that if I saw it correctly before it disappeared, the top two answers were about donor engagement and about how to encourage donors to be both more flexible and sort of more generous in supporting some of these initiatives. And I'm just reflecting on the fact that point comes up every time we talk about participation and has done so for many years. And so I'm wondering what the sort of practical steps are. And I don't know if there are any donors actually on the call. It would be great to hear from them if there were. But what what the next practical steps are that we could take to either support donors or work with donors to kind of either dispel some myths, because I know that in some cases donors can be more flexible than we think, but often we assume that they're not going to be, and so we don't ask them for certain adjustments. But also what we can kind of work on together to unlock some of the potential that we have if donors fully embrace the kind of participation revolution agenda. And I know that a lot of different donor agencies, you know, the UK particularly, and the US and Australia, are really looking at this agenda. And so what I would hope is that they were getting together and looking at this together to see, you know, what are we sort of aiming for as a humanitarian community with participation, and how has that perhaps changed because of the COVID response? And what are maybe the top 3 things that donors could together aim to achieve, you know, by the end of the year? And I think that would spur a lot of change across the whole system.
Excellent. Thanks a lot for that, Meg. And for any of our other panelists, if you'd like to come in and comment on the exercise, on some of what you saw coming out of the inputs from today's participants, please make a quick note in the presenter chat, and we'll jump over to you. In the meantime, we have a few questions that have come in. I'd like to go back to a few of you. So first of all, this is a question to Seda, coming in from Wendy. So you had mentioned, Seda, in your remarks that in your context with the solution that was put in place, it was received very well by the affected people, but that there was actually a negative reaction from staff and partners. And Wendy is wondering why that was the case, and if you could elaborate a bit more on that dynamic. Can we try going over to Seda?
Okay. Thank you very much. Actually, we look at the issue. It's the first time staff performance and partners' performance are monitored by the refugees. And they started to put in place, because we put 15 days limits for partners to give feedback for each complaint mechanism, because it is going directly to the partners, and it's become a project monitoring. When within 15 days no response comes, we are coming back to them. So refugees understand that there is a restricted time, which they are very happy on that one. But the partners, when we first send these connections to them, they come up with us, you know, it is lack of funding, we didn't take action, or they didn't plan it well. So the first year there's a bit of a reaction, because it's, as I say, it's a behavioral change. Partners never get used to be monitored by the refugees, and even our staff never get used to, you know, monitored by the refugees. You only receive sometimes complaint emails, but now it's actively real time. They are monitored by the refugees. So this is the way, and it took almost 1 year for partners and also the UNHCR staff to get used to it. And the second year, that's why also for the refugees, their focus is changed, and because partners, they started to also respond more effectively. I hope I answered the question of Wendy.
Excellent. Thank you so much for that. I have a question now coming from Sarah. This is a question for Charlotte, and it's regarding the risks associated to participation. So in many cases, and I think Charlotte, surely in the context where you've been working, there are risks associated to participation on the part of affected people. I wonder if you could elaborate a bit on how those risks were proactively identified and mitigated on your part. Over to you, Charlotte.
Yeah, thanks very much for that. So yes, obviously when working with communities, we have to make sure that their safety and is first and foremost. And going back to that, understanding the communities and understanding who you're working with, ensuring that you've done a thorough, if you have the time, a thorough context analysis with a strong protection analysis that will help you understand what are the risks that face any given community, and bearing in mind the risks will vary from subgroup to subgroup, for men, for women, for children. And so really having that thorough understanding of the risks in that area by consulting with people who have the local knowledge and the experts, by leaning on existing materials, conducting that desk review. Once you get that broader picture of your protection analysis, it can really help to inform your programming from design to evaluation, and making sure that we're putting the needs and the security and the safety of the people that we're here to serve first. And I think it's always important to keep an eye on it, especially if you're operating in a rapidly evolving context, is to keep an eye on that protection analysis to see whether situations will change as you move forward with programming. But we really try to embed strong protection analysis that feeds into the context analysis into our program design. Thank you.
Great. Thank you. And a question for Meg. This is coming in from Donatella. Wondering about the balance between participatory versus expert decision-making processes. And I wonder if you could reflect a bit, Meg, is this a versus situation? Is it a participatory approach versus expert decision-making process that we're talking about here? Or how can we think about the relationship, or sort of the positive relationship between participatory approaches and expert-driven decision-making processes? Do you have any reflections on that that you can share with Donatella? Over to you, Meg.
Yeah, thank you. I mean, I guess all of these conversations have to happen within individual contexts. And I think participation also, as we all know, is kind of on a scale and can be impacted by certain factors, including types of crises, etc. From what we've seen, just looking at the data that Ground Truth has, there is definitely a link that we have found. It's not an overwhelming link, but it's a link between people who feel that their opinion is taken into account in a humanitarian situation and those people's positive prospects for the future. And so I think it's interesting that you know, expertise in decision making, from my understanding, is very much informed by community input, and the point that Charlotte made about understanding of a context. And so I think that participation definitely doesn't need to be, you know, a collaborative process where a whole community has to decide on something for it to be approved. And obviously humanitarianism involves certain skills. Sometimes they come from the outside, sometimes they come from within a community. There's various ways we can approach participation, but I think that the most expert decision makers in humanitarianism and policy would agree that those decisions would be very much informed by the views, perspectives and actions of disaster affected people. And so I think it's more of an and than an or, in my humble opinion.
Perfect. Thank you so much for that, Meg. And I think a really an excellent question that came in, and I see there's some discussion on that now in the chat as well. So I have another question that's come in for Seda. This is coming in from Melanie. Has this more in-depth enhanced input from refugees, from the community, made a difference in your ability to advocate effectively with the host government? Great question, Melanie, and let me send that over to Seda. Over to you.
Thank you very much, Melanie. It is really a great question. It's definitely changed our relationship with the host community. One of the things is actually the host community and the government of Kenya, they started to use the tool because they understand the effectiveness of the tool, and instead of their receiving complaints, they want to be part of this tool, and they want also their services to be monitored by the refugees. So I think in that respect, there's a great participation on that one. Nowadays, we are also talking the host community. They want to be also part of these services, and we are in discussion with the county officials in the Turkana region, where the Kakuma and the Kalabeye, how they can use these services, which is only designed for refugees, but we can expand for the host community, because they think that the self-services and online, which is already happening in Kenya, which is called, they have the Huduma centers, is it possible that they can link with the centers and it will be also used by the county and by the national authorities? So, but this came up in the second year. It was not in the first year, I have to mention, because we need to see the impact and we need to do a lot of community awareness and explanation. And in that part, the refugees are really the key, and the partners also really the key to explain this also to our government partners. Over to you.
Great, thank you very much, Seda. So we're going to allow ourselves to go just a little bit over time here, since we had a couple of interruptions today. I think it would be terrific to go once more around the virtual table here and ask each of our panelists for reflections on any of the questions that have come up today, or the results of the exercise, or indeed any of the rich discussion in the chat. Nanette, do you have any reflections that you'd like to share as final thoughts from your side following the rich discussion today? Over to you.
Thank you. Yeah, I'm just happy that the issue of trust has been taken and given weight and attention and in the overall discussion, because we really feel that it is very important. Of course, with trust comes also the accountability, as what we are promoting with the SELR. And accountability is like a multidimensional, top down, down bottom. And but I think what is really what we are aiming to see is like accountability, because now we are more like asking accountability of from our local partners to donors, but what we are hoping to see someday is like more accountability to the people on the ground, to the crisis affected. And so hopefully one day we can really see that the people, the aid recipients, would be the center now of humanitarian response, making humanitarian really humanitarian and not only focusing on the aid itself. And that would require, of course, systems change and rule change. Thank you.
Great, thank you, Nanette. It was terrific to have you on the line today and to hear from your experience. Thank you so much for taking the time to share with us. Charlotte, can I turn to you? First of all, thanks so much for being with us. And could I ask you, Charlotte, for your own reflections on the discussions today? Anything you'd like to leave us with? Over to Charlotte.
Hi, yes. So thanks very much for having me. It's been super interesting and a privilege to be a part of this panel. I think that I saw a couple of questions about participation, especially with persons with disability, and I think that that's a topic that we weren't able to really get into today. But I think when we think about participation, I like the phrase that persons with disability use, which is nothing about us without us. And this really means if you want to engage with the people directly, and engage directly with persons with disability and or their representatives of their organizations. So I think that this is a nice approach, and something we should bear in the back of our mind, that we should really be putting the people at the center of what we do, and that this nothing about us without us approach is really a way in which we should sort of move forward to ensure that participation. And UN Women is currently hosting a series of webinars on gender responsive disability inclusion. I'd be happy to share the links, but it frames the conversation nicely, because we also have, through the DPOs, we have this structure that we can tap into that can help us understand the various elements of society. And going back to that risk question earlier, if we want to understand the risks of engaging with persons with disability, for example, then let's go to the DPOs themselves and ask them what they think. Thank you.
Thank you very much, Charlotte, and thanks for sharing those points with us, and very interesting resources, I think, for everyone to follow up, and thanks to you also for taking the time to join us today. We'll give it another try. May, are you there?
Yes, can you hear me?
Yes, yes, we hear you very well, May. I'm so glad to have you back on the line. Yes, could you share with us some thoughts? Hopefully you've had a chance to read a bit in the chat and see what's going on in the event. What would you like to leave us with today as final thoughts? Over to you.
Yeah. I would like to say something. A lot of talk is about the nexus, humanitarian and development and peace, and participation actually is very, very important to lead to nexus. So I'm encouraging everyone not only to think when the crisis happens, there is a lot of preparedness to change the culture, not only of the donors, but also the local organizations, the international organizations, and the communities themselves. Because till now, people are looking at themselves as passive. They are waiting for the donors or the people to help them. Let us together start by participation changing this culture. Thank you. Over.
Thank you, May, and thanks to you for taking the time to be with us. We really appreciate your inputs and your reflections. I'd like to turn to Seda. Seda, what would you like to share with us as we wrap up today? Over to you.
I think I have two things to take from here. Is the first thing is the transparency. It came up in several presentations and the comments from the chat box. And the second thing is the sustainability of these things. So we really need to give a chance to our affected people that they are resourceful and they have to feel the ownership. They can definitely bring the solution if you give them the chances. So we need to identify their resources, their skills, and then as organizations, whether international or national, we try to give them a chance to show their skills so that they will own this process. They will not waste these things coming from the organizations. Thank you very much for everybody.
Thank you, Seda, and thanks for being with us today. To all of our participants, before I turn to Meg and then to Gareth, I would like to point out we have an important final set of polls here. We're really hoping to get all of your inputs. First of all, on the question of whether this session has actually changed your own perspective on the practical feasibility of including affected persons and communities in humanitarian response. And then also if you can share with us, once again, anything in particular that's been discussed during the event that inspired you or might lead you to take follow-up actions. That would be tremendously helpful if you can provide your inputs there as this discussion moves forward. Now, I'd like to turn to you, Meg. What would you like to leave the group with today? Final thoughts. Over to you.
Yeah, thank you so much, and thanks again for having me. It's been super interesting, and I'm really happy to have been invited. Actually, I'm going to end on something that I've just been reading, the fascinating chat in the side panel, and I think the point that Dalia has raised about our ideas of participation and accountability as international actors and just keeping checks on those. And Dalia's idea to sort of start from an idea of seeing what exists already and then how do you support that, which came up in my remarks as well, I think could not be more important. And I would just echo Smruti's comment as well that this is going to be completely vital in the way that we respond to COVID. And so I think it's a great opportunity for us to look at the great examples from today and see how we can take those further and scale them a bit more across the board. And I think that there's a lot that we could achieve.
Great, thank you very much, Meg. And then last but not least, Gareth, I'd like to hand the floor back to you for your own concluding remarks and reflections on this session. Over to you, Gareth.
Thank you very much. So for me, this highlights the importance of those flexible enabling approaches at the global level. One thing I would say is, do push your local donor representatives. I think the flexibility is there if we push for it, if we use it, and I think that's really important for making that, to make participation happen in practice. Also, just in terms of follow-ups, if anyone would like to join the workstream, do please send me your contact details. It's simply schr@ifrc.org. And also, we'll be following up on this, so both through the workstream mailing list, also through the Grand Bargain updates that you can find on the Grand Bargain IFC website, and in the Grand Bargain annual report as well. Please just keep doing what you're doing. It's inspiring to hear the work that's been happening in the field with so many of you. And I know, we were trying to discuss how many speakers we could fit on the call because we know how many examples there are, how many great examples there are happening. And I'm delighted to see the high number of you saying that this webinar has made you feel that participation in practice is more feasible. That's exactly what we wanted from this. And please do, yes, keep doing what you're doing. And thank you so much for everyone for bearing with us. Super congrats to PHAP for getting us back up so fast in a tough working environment for the online stuff. Thank you.
Great, thanks, Gareth. Yes, I'm afraid that's a first for us to have the entire Adobe platform crash. But thankfully, we were all able to come back, and I think really got a lot of value out of this event. Yes, I just echo that, Gareth. It's really rewarding to see how many people online today feel that it's more feasible now participatory approaches than they felt at the beginning. So that's really terrific, and there's much more work to be done. In the meantime, we'll just wrap up with our usual technical notes regarding the event. So there will be a recording of the entire session today. We'll perhaps cut out some of the messy bits in the middle when we lost everybody, but there will be that recording both in video and audio only podcast format. That will be available on the event page in the coming days. You'll receive an email about that so that you can share that with your colleagues, refer back to it. You'll be able to see the whole chat and all of that in the recording, so you can use that as a resource. We'd also like to invite you to join us next week. We have an event coming up on the 2nd of April. This is a webinar organized together with the Camp Coordination and Camp Management Cluster, the CCM cluster, on how to operationalize technical standards in camp settings when faced with COVID-19. If you're interested in learning more, you can read more about that on the event page. There's a link there on the PowerPoint slide at the top of the screen, and you can already register there. So with that, I'd like to thank everyone. It's been terrific to have you on the line, a really engaging event, and as we said, plenty of follow-up work to do. We posted your email, Gareth, in the chat there, so hopefully you'll be hearing from people who are interested in joining the work stream and following the work from this point. So with that, I'd like to thank everyone, both panelists, participants, and to the whole team behind the scenes here for making this a reality. Many thanks to you, and we look forward to seeing you again in the online sphere in the very near future. This is Anne Herod-Lang signing off from Geneva.